When Duke University and University of North Carolina studied the genetics related to heart disease, they really only found about 2-3% of those folks that got it really had genetic problems with it. It was more the chronic oxidation and inflammation and habits that led to the disease. So you don't get a normal explanation sometimes, because when you go a layer deeper, as naturopathic physicians do, you get to that balance where we do have repair mechanisms for vessels, and when they're unable to keep up, then you develop the syndrome. Cardiovascular disease is an imbalance and a repair mechanism. So the body nicks coronary arteries and the vascular system through the day and repairs it. When that mechanism isn't working properly, then you get cardiovascular disease. Conventionally, what they're trying to do is interrupt the disease at either the cholesterol manufacturing process, or they're trying to interrupt the disease when it's 70 to 90% to 100% occluding a vessel. For naturopathic physicians, it's a very predictable disease. If you have chronic oxidation and inflammation in your body, you will develop the disease. When 1 in 3 Americans develop cardiovascular disease, you have to start to look at who isn't getting it. You know who isn't getting it? The people who don't have chronic oxidation, the people who don't have chronic inflammation, and the people who have good nutrient status. So as a naturopathic physician, with my patients, my goal isn't just heart disease. My goal is to get them to 85 and functional. So there, if I look at oxidation and inflammation and this chronic mineral deficiencies that develop with these folks, and you reverse those issues, you don't have the problem. I've been practicing as a cardiologist for over 12 years. I've only had one patient have a heart attack, and they're doing just fine today. That's not by coincidence. That's by following the laws of physiology, which we know. The causes of heart disease are indisputable. Oxidation, chronic inflammation, how you treat those and identify those is very different. When a patient has a 15% occlusion, if they can find it, because generally angiography and stress testing doesn't find it, but if you have a sensitive CTA test, for example, that finds a 15% blockage, this is dangerous. These are the ones that rupture and kill you. The 70, 80, 90% blockages can cause chronic chest pain, but they're not the ones that kill you, which leads to supportive statistics. Angioplasty, stenting, bypass surgery don't prolong life. They get rid of chest pain. They get rid of 80, 90% occlusions fast and furious. But those aren't the ones that generally kill you. This is in medical books. This is accepted. I taught cardiovascular disease to medical students for 7, 8 years. This is in the books. Those 15%ers are the high alert people. They need to be on things that make blood slippery. They need to get all that inflammation under control, not by just going on a statin medication or if at all, by looking to where the inflammation is. Inflammation is fuel to the fire. If you have a little bit of heart disease, throw in a bad digestive tract, throw in some joint pain, throw in some skin rashes or estrogen dominance, now you got a fire. Now you have a little spark going to a fire. Where the naturopathic physician can go is to where the inflammation is. Get the gut problems under control. Get inflammation out of the intestines. Digest your food properly. Get the skin rashes under control, not with steroids, because that's going to lead you to a later heart problem, but with the natural therapeutics that we're the experts in. Getting these chronic inflammatory things under control is huge. If we use ibuprofen for joints, we would expect there to be heart problems later, like the statistics tell you. I've used glucosamine, chondroitin, and homeopathy, and you detox their livers, and their joint pains get better. Now we got a heck of a system, and that's why we've been around 120 years.